I will now welcome Pam Fonseca, Health Promotion Manager at Heart and Stroke.
Thanks, Kirsten. Hi, everyone. As Kirsten noted, my name is Pam Fonseca, and I'm the Health Promotion Manager with Heart and Stroke, based in Halifax, Nova Scotia. I'll be one of your moderators for today. I want to start by acknowledging the land on which I sit here in Halifax. It's the traditional unceded lands of the Mi'kmaq people, and we're gathered today because of a shared commitment to equity and health equity in particular. By sharing this acknowledgement, we are showing our commitment to reconciliation and increasing our awareness of Indigenous history and perspectives. Heart and Stroke is focused on building meaningful and collaborative partnerships to improve health outcomes for all people. So I encourage you to reflect on what this acknowledgement means for you in your work and in your lives from coast to coast to coast, or wherever you may find yourself as you listen to our speakers today. Heart and Stroke employees across the country have been working rapidly to bring you reliable and credible information as we navigate these times. If you have not already done so, please find us on YouTube and follow us on Twitter at HSF_science and at Heart and Stroke, where we are constantly updating resources and emerging information as it relates to heart, stroke, and vascular cognitive impairment. Alongside our social channels, Heart and Stroke has also created a specific COVID-19 page on our website. To view this, please visit the link at the top of the page there, heartandstroke.ca/coronavirus. You will be then brought to a page that looks like the following on the left-hand side of your screen. By clicking on the drop-down menus to view our extensive lists and ever-growing resources. This is also where we will be updating the links to our webinar recordings, articles, and other COVID-19 resources. As for upcoming webinars, we have some new topics in the next couple of weeks. So tomorrow we have a French sex and gender differences in management during COVID-19. And of course, the first week of May, it is Heart Failure Awareness Week. So our team is working hard to bring you some great information for this as well. And you'll see that there's also a webinar planned for that and how to improve your heart and mental health during COVID-19. And we will also have an aphasia webinar that will be coming up shortly. Stay tuned on that because it might actually get moved to May 14th. So in addition to our webinars, we are also bringing you information in different ways to best suit you. So as noted, be sure to check out some of our other platforms and ways to connect. Now I'd like to pass it on to my co-moderator today, Jennifer Monaghan. Jennifer is a woman with lived experience, a dedicated heart and stroke volunteer, and she is based in beautiful British Columbia. Over to you, Jennifer, to take it away.
Thanks, Pam. Hello, everyone. My name is Jennifer, and I am one of your co-moderators today. I am a woman with lived stroke and heart failure experience, and I'm also a proud heart and stroke volunteer. I believe that today's webinar subject is very important. 8 years ago, a stroke left me unable to speak or move my right side. I stayed in the hospital for about a month and felt incredibly lost upon discharge. And that was at a time without any virus-related issues. It was a lot of hard work to get to where I am now. But on the positive side, my health challenges have led me to London, England. There's pictures on the screen, where I volunteer on an international panel charged with judging the Big Beat Challenge, which is a global competition for world-class scientists to win a £30 million research award from the British Heart Foundation. Imagine transitioning from practicing my ABCs and 1, 2, 3s to helping choose which research team's transformational solution to a significant problem with heart disease gets £30 million. Outlined on this next slide, you will see a webinar overview. We will talk about the unknowns right now for people managing heart conditions, the impacts of stroke, and vascular cognitive impairment, particularly as new information around COVID-19 continues to unfold. With limited access to in-person healthcare and physical distancing requirements, many questions and challenges have been brought forward by the heart and stroke communities. Managing health conditions is even more stressful when you're newly dealing with a diagnosis and perhaps have recently transitioned from hospital to the community after a cardiac or stroke event. People are experiencing changes with emotions, activities of daily living, canceled or delayed appointments and procedures, medication routines, social isolation, relationships, and many other lifestyle factors. Today, our speakers will be following these key topics. First, what to expect during COVID-19 as you or a loved one transitions through the continuum of care and into the home or community environment. Second, practical tips for dealing with these changes and managing conditions as you reintegrate back into your home or community. And third, the available resources, supports, and self-care strategies that are essential for people with lived experience and care supporters to prepare and manage transitions at this time. I am pleased to welcome 4 speakers who are experts in transitions and systems of care. They will be sharing some important information as it relates to COVID-19. I will be introducing them further as we go, and then I will be handing over the question and answer portion at the end of the webinar to Heart and Stroke's Director of Systems Change and Stroke Programs, Patrice Lindsay. I want to give a special thank you to our speakers today, who are all taking time from their busy schedules to bring us this important information. Our first speakers are Jim and Sherry Beattie. Jim will speak about his recent admission to the hospital and transition home on March 16th, just as the COVID-19 precautions began. And Sherry will speak about her new role as a caregiver during COVID-19 and the importance of advocacy for follow-up care. Over to you, Jim and Sherry.
Hi, how are you?
Hi.
Well, I don't have a whole lot to say, but I can tell you that I was lucky. I was one of the lucky ones because they really started to talk about COVID-19 on March the 13th. And it really didn't sink home. I ended up being released the morning of March 16th, which was pretty quick, truthfully, after surgery. And I thought, well, that's good. I can heal quicker at home than I can actually in a hospital. The biggest shock to me was when we were leaving the hospital. My son and my wife, Sherry, were taking me down to get in the car, and I had to sit and wait for about 5 minutes until my son got the car. And they were pulling everybody who was coming in the door over to the side. No spacing between them. They were as tight as sardines in a can. And they were all being asked questions about the standard things with, do you have a fever, blah, blah, blah. And this older gentleman who was on the door saw me sitting there, and I must have looked really scared because he grabbed the mask and brought it over and gave it to me to put on. But I couldn't wait to get out of there. And little did I know the effect that it was going to have with hospitals and everything else. So transitioning for me was not a big deal. It was just getting out of the hospital that was a scary part. I think that the early release gave me a better chance at healing, because when you're in your own home and with your own surroundings, and with me, I'm lucky enough that my wife and I have a fantastic relationship, and she's better than most nurses. So there's been no problems that way. How do I cope with it? Well, it's not that big of a deal, actually. Other than my doctor's appointments are all by phone, which is a little odd. I call her once a week, and I have to give her an update on blood pressure and weight and pulse, blood sugar, because I'm type 2 diabetic. And that's basically it. Temperature. I did have one little setback. I ended up with pneumonia, but with antibiotic therapy, it worked out fine. Let me see. What else is there? The online community. I just wanted to mention how important that is. And if you're not a part of Facebook's community of survivors, which I am and my wife is, I would highly suggest that you join it. good information. People work together. If you have a problem, you can post it on there, and they give you good, solid answers that aren't too technical. Nobody claims to be a doctor unless they are a doctor, and we have had a couple on there that have given some advice, and that's basically it. So
I was booked for an ablation March 31st, which was canceled about a week and a half before my surgery was to take place. So I am still in a holding pattern, waiting to be called back to have my ablation done. So I've been taking care of Jim while he's been healing. I've been the one to run all the errands. We're lucky enough to live in a very rural area, so we can get outside, exercise our dogs, but I have to run about half an hour in town to get groceries. So I've been waiting until we've needed a prescription picked up and then done a major grocery shop. I have my little baggie with Lysol wipes, a little baggie with rubber gloves, and I have a little bottle of Purell that I always take when I'm shopping. And we, as soon as I get home, we just scrub and wash really well. The stores aren't that packed. Everybody's been very good about staying 6 feet away from each other. Nobody's really been getting in your face or anything like that. So it's been pretty good that way. The online community we have so many wonderful people in our online community. We have everybody's really great about giving hugs and love and supporting each other during difficult times. And all somebody has to do is say, I'm scared, or I can't sleep, and there's somebody online just there with you all the time. So I think the biggest thing is that you just need to look after yourself. Take this time to just relax and don't worry if things don't get done. Because a lot of people are just going nuts about, well, I need to be doing this, I need to be doing that. But right now, you just need to look after yourself and make sure you're safe. Don't be afraid to ask for help on the online community or from your family. Everybody needs help sometimes, and we have our son who will pick up stuff for us if we really need something. He's stopped into the store and picked up a few things for us. And don't be afraid to advocate for yourself. If you are having issues or nobody listening to you, you post your problem on the online community, and there's always somebody who has great advice as to what you should be doing or what you can do to help promote yourself or try to get the answers you're looking for. And I think that's
mm-hmm.
it.
Thank you, Jim and Sherry, for sharing your fresh transition perspective and experiences during COVID-19. We appreciate your taking the time to share something so personal with such a large virtual audience. If you have any questions for Jim and Sherry or any of their other speakers, you can enter them online through the chat box anytime, and they will be dealt with at the end during the question and answer period. Our next speaker is Dr. Elissa Weinberg. Dr. Weinberg is a family physician from Toronto, Ontario, and she will be speaking about virtual care and some practical tips on how to manage your health during COVID-19 transitions.
Thank you for having me. I was asked to speak today about how family doctors are practicing during this COVID-19 pandemic. specifically how patients can manage their own health together with the shared support and advice from their family physician. The main message that I want to get across to all patients is that family doctors are working. We are accessible. And if you need to reach your family doctor because of any medical concern, it is possible. I have no conflicts of interest at all to declare before this presentation. Let me tell you about how family medicine has changed over the last several weeks. Most family physicians have switched to a virtual care model. This means that patients are booked for a telehealth visit first instead of an in-person medical visit in order to limit possible contact with others who may have the virus. A virtual visit can be done by telephone or by video conference. All patients must provide verbal consent agreeing to use telemedicine, acknowledging that in some urgent cases, advice cannot replace the importance of an in-person visit. In the last few weeks, I've been giving advice and treating patients based on history alone, information gathered by a video, or even from photos sent to visualize rashes or other complaints as well. Let me go over a few examples to show you how virtual medicine is working for family physicians and my practice. First, family physicians are giving advice how to decrease exposure to COVID-19 and stay safe during this pandemic. Virtual medicine is helping to screen patients with viral symptoms who are worried about COVID-19. I'm directing patients to testing centers if they have concerning symptoms. At the present time, there are no restrictions and testing centers are actively testing anyone with symptoms. In patients with suspected COVID-19, I'm giving advice on how to manage their symptoms while staying at home. I'm also guiding them through concerning symptoms to look out for. For example, in patients with heart failure, it's very important to differentiate between features of the virus versus features of a heart failure exacerbation. Any patients with complaints of chest pain or shortness of breath are directed to the emergency room for a comprehensive workup. During this time, family doctors are also managing other acute conditions with telemedicine. Skin rashes, eye infections, urinary tract infections, gout, back pain, to name a few, can all be managed virtually. Laboratory tests, x-rays, or other imaging studies can be requested as centers are open for necessary investigations. Using telemedicine, I'm able to follow my patients with acute medical conditions to resolution. Patients also can advocate for themselves by continued virtual follow-up with their physician to manage their symptoms with guidance. The COVID-19 pandemic is stressful. Family doctors are also around to help patients manage their mental wellness. So I encourage anyone who is experiencing overwhelming anxiety, stress, loneliness, or depression to contact a health professional for support and counseling. I'm also directing patients to online self-help programs that can teach cognitive behavioral therapy. Bounce Back Ontario, eCouch, or Mood Gym are different online sites that provide support. There are also many strategies that can help patients cope. I am recommending my patients keep a strict schedule during self-isolation. This is especially beneficial to patients who are working from home and taking care of their children. A strict schedule keeps everyone organized and allows parents to fit in time for themselves. I encourage patients to get up, get dressed, have regular timed healthy meals, and schedule time for yoga, meditation, and exercise. During this time, there are many free exercise classes that patients can access online. I continue to encourage regular exercise in most patients with chronic illness like heart disease, 150 minutes of physical activity per week. It is possible, even during this pandemic, to do this safely by staying 6 feet away from others when going for a walk. Chronic medical conditions can also be managed with virtual visits. It's very important for patients with chronic medical problems like diabetes, hypertension, heart disease, or a past history of stroke to be followed by their family physician during this time. In my practice, I'm actively renewing patients' chronic medications. During telehealth visits, I'm ensuring that patients with a history of heart disease or stroke who have been prescribed cardiovascular medications like ACE inhibitors, angiotensin receptor blockers, as well as low-dose aspirin, continue to take their medications as prescribed. There is no evidence that these medications make people more susceptible to COVID-19 infection or worsen the outcome. It's very important that patients speak to their family physician first before discontinuing any chronic medications on their own. Aspirin is still not recommended for healthy people with no history of heart disease, no history of stroke, or no history of peripheral artery disease as per current guidelines. There is a lot of misinformation on the internet. I encourage patients to communicate with their family doctor to review any questions they have about medication. I've also had patients who have recently lost their job and their drug benefits. Certain medications now are too expensive. It is possible to make simple prescription changes so medication is affordable for each patient. During this time in my practice, I'm keeping track of my patients with hypertension. Patients can measure their blood pressure with a home blood pressure monitor. A blood pressure monitor can be purchased at any pharmacy. I'm still able to order laboratory tests that cannot be delayed to check sugars in diabetics, electrolytes like sodium and potassium, renal function, or INR tests in patients on Coumadin. Many patients taking certain blood pressure and heart medications require these lab tests for appropriate monitoring. Laboratory tests can be arranged at home or a local lab where safe precautions are in place. In my patients with heart failure, I'm asking them to monitor their weight and to adjust the diuretics if they experience weight gain, leg swelling, or congestion. If needed, investigations like echocardiograms and chest x-rays can be ordered as well. All specialists, including cardiologists, are working at this time. Telehealth consultations with specialists are available for any urgent concerns. In my practice, patients with a history of stroke, I'm encouraging them to stay active and to try to maintain the gains which they have made by continuing to do their home exercises. This is a very challenging time, as you heard, for patients recently discharged from hospital, often very quickly. I encourage patients to use their family physician to help advocate for needed services. Home care services are running with safety precautions in place. Patients discharged after a stroke have follow-up assessments with neurologists virtually and are set up for tele-rehab. Patients can also access websites like the Ottawa Hospital Research Institute, their patient decision aids. There are decision aids on a variety of health topics, and these are good tools that can help people become more informed and involved with decision-making with the help of their family physician. Am I seeing patients? Well, after a virtual visit, if a physical exam is needed to assist with the diagnosis, then I am requesting an office visit. In my group of 10 family physicians, patients are asked to wait in their cars when they arrive at the office. One patient at a time is called into the clinic to go directly into an examining room. No patient comes into contact with another at any given time. Patients are provided with a mask and gloves to wear while they are in my clinic. Physicians are outfitted in appropriate protective gear, including mask, gown, plastic face shield, and gloves. So the bottom line is, if needed, family physicians are seeing patients using safe protocols so as not to put our patients at risk. More importantly, emergency rooms are also seeing patients in the same safe manner. Emergency rooms are divided where patients with suspected COVID-19 are kept separated from patients with other acute issues. Necessary precautions are in place to minimize a patient's risk of exposure while being treated in the ER. It is important for all patients to know that emergency rooms are running as usual, and patients with any urgent concerns like shortness of breath, chest pain, focal neurological symptoms, abdominal pain, or an altered state of consciousness should proceed to the ER for assessment. Do not hesitate. I hope that I was able to relay the message that family physicians are here for you, practicing medicine in a new, safe, and effective manner. So if you have any concerns, contact your family physician for a virtual appointment. Thank you, and I hope everyone stays home, stays safe, and stays connected with their family physician. Thank you.
Thank you, Dr. Weinberg, for your insights and guidance on managing our health conditions during these times, and also for such an important note at the end of not ignoring the signs of a true medical emergency. We all need to continue to share that message. Once again, if you have any questions for our presenters, use the questions box on your GoToWebinar dashboard. Next, we have Brenda Semenko. She is an occupational therapist for 28 years, primarily in the area of stroke rehabilitation. She currently works for both the Community Stroke Care Service in Winnipeg Regional Health Authority and the Outpatient Neurology Service at the Health Sciences Centre in Winnipeg, Manitoba. Brenda is also a guest lecturer at the College of Rehabilitation Sciences at University of Manitoba, and has been involved as a writing group member in 2 updates of the rehabilitation module for the Canadian Stroke Best Practices Recommendations. Thank you, Brenda.
Hello, everybody. Good morning or good afternoon, depending where you are in Canada. For me, we're still at 11:30 in the morning. Thank you so much for the opportunity to share some of my insights with you today on this very important topic. I'd like to start with an occupational therapy perspective, or a way of thinking about how some of the changes experienced after a stroke and other health conditions can affect daily functioning, and try to integrate that with all of the other changes we're experiencing now with the COVID-19 pandemic, because those changes are obviously affecting our daily functioning too. On the left side of my first slide are some of the things that may be different after a stroke, depending on where the stroke occurred in the brain and the severity of the stroke. Physical changes with your arm or leg movement, your balance, changes in your sensation, pain, as well as possible changes in your vision or your speaking or your ability to swallow. Cognitive changes, such as difficulty with paying attention to things, or your memory, or your thinking skills. Perceptual changes, such as making sense of what you are seeing or feeling in the space around you, and the concept of time, or how much time has passed. Emotional changes are also very common, such as feeling more emotional than before, feeling depressed. Changes to these 4 areas after a stroke or other neurological event can affect the person part of the diagram on the right, keeping in mind that many parts of that person have not changed, such as their likes, their dislikes, their beliefs, and their values. What we are currently dealing with in the world with COVID-19 has affected, for most of us, the environment part of this model. Our physical environments. We're home now more than ever, and when we do go out, our stores and other familiar environments are so different. And our social environment. We're spending way more time with those who live in our homes now, and no physical time with others who we maybe previously saw quite regularly. COVID-19 has also affected the occupations part of this model, or what we need or like to do every day. This could be daily activities like brushing our teeth, getting dressed, making our meals, but also things like completing work or school tasks, looking after our children or grandchildren, as well as the things we like to do for fun, our leisure activities. It's the relationship between these three areas, the person, the environment, and occupation, that affects how we're all able to function in the day-to-day tasks that are important to us, our occupational performance. As therapists, this is what we're trying to maximize in therapy, considering all of these areas. As therapists, we're also aware that for those recovering from stroke or dealing with vascular cognitive impairment issues, heart disease, or other medical conditions, that it's not only the environment and occupation's parts that have changed these last several weeks, it's parts of the person component too, in many cases. That's why this is a particularly challenging time, and indeed a very stressful time for those recovering from or dealing with these conditions right now. We all have the need to complete meaningful and purposeful activities every day, to feel productive every day, but this is much more challenging now, and especially for those recovering from illness of any type. Transitioning from one environment to another is also challenging, even without COVID-19. From an inpatient unit to home, for example, or to more of a long-term care environment. I know that the length of time that people are staying on acute care wards and on inpatient stroke rehabilitation units has decreased for a variety of reasons, including the fact that family members are no longer allowed to visit their loved ones in the hospital, and the obvious need to free up hospital beds. With shorter inpatient stays, there may be less opportunity for therapy, and also less opportunity to connect with others who are also recovering from stroke. I know that therapists are working very hard to ensure people have started therapy programs and have some tools that they need to start to progress their programs at home, but this isn't always ideal. Many hospital-based outpatient programs are not currently open. Community-based programs may remain open, depending on how their program is set up and the directives they've been given. Here in Winnipeg, because the Community Stroke Care Service is part of our home care program, some urgent therapy visits are still possible with rigorous pre-screening and using PPE. We are perhaps fortunate that way here. After initial programs are set up, phone and virtual visits are being used to monitor and progress the therapy programs. Although a therapist may not be able to see you in person, it is important to try to connect with a therapist in either the public health system or privately, as phone and virtual or video appointments are still happening and are very important as you continue your therapy at home after discharge. Therapists can progress your programs this way. The idea of doing therapy at home is not new. In fact, doing therapy at home is required in order to get in the number of repetitions needed, hundreds to thousands of repetitions, to change the brain, what we call neuroplasticity, and then to promote further recovery. This repetition of tasks is best done with tasks that are important to you, holding your phone, for example, or learning to eat again with your dominant hand. I regularly encourage my clients to think of their therapy as their job or work for the next several weeks or months, as that is the level of commitment that is often required. So some of the things I would suggest to work on, some strategies on this next slide. Let's look at maybe each of the 4 person areas separately. Knowing that if possible, try to connect with a therapist to help set this up for your individual needs. If you have physical changes, there are many resources out there, especially for those, for example, with arm weakness or changes. Stroke Engine is a Canadian website that many of you should try to check out. It's excellent. It provides best practice information to both families and healthcare professionals on a variety of assessments and treatments in many different areas. Everything from upper and lower extremity intervention, communication, mood, activities of daily living, and many others. I've included a link here to the part of the website that has a how to do mirror therapy section, but certainly check out other areas of this website as well. The GRASS program, developed in British Columbia, has a home-based program with items you have around the house and is for those with some active shoulder movement and also some ability to straighten the wrist and let go of objects. I've included the link to this program here. Also, we, a few occupational therapists in Winnipeg, developed an upper extremity toolkit a couple of years ago, which we're keeping up to date, which is based on the Canadian best practice recommendations and has some photos of passive range of motion exercises for your arm, where you would use your other arm to help, and also some ideas of how you can move your arm actively or on its own more as well. It's important to try to move and use your arm as much as possible. For your leg, for balance, use whatever equipment, walking aid or ankle brace that was prescribed for you until reassessed by a therapist. Walk if you've been encouraged to do so. Doing exercises and sitting or lying on your bed may be safer initially, unless you've been told otherwise by a therapist. For your communication, practice talking and writing if you can. You can even try some singing. For your vision, if this is an issue, your family should try to position themselves on the side that you have difficulty looking toward and encourage you to look at them during conversation. Practice reading aloud. Use a straight edge under what you're trying to read and a colored strip at the left side if needed to help your eyes get to the start of the row. If you have cognitive changes, again, read aloud. This works on your vision, but also your attention. And then discuss what you've read with someone else. Read something that doesn't have to do with COVID-19. Develop a system. Write things down, record when and how many reps or exercises you did. Also record the amount of sleep if this is an issue for you, and any changes you're noticing in your mood. Use a journal to record things. Write things down on your calendar. Try to minimize distractions as much as possible. The sound of the TV or the radio or bright lights when you are trying to concentrate on something. Try some cognitively challenging tasks. Games, for example. Cribbage, for example, is very good for mental math skills and for paying attention. Follow a simple recipe. If you have perceptual changes after your stroke or neurological event, pay attention to the weaker side and dress your weaker side first and undress it last. Challenge yourself with perceptually challenging tasks, such as puzzles or games, word searches. Lego is a great activity to try. Try to follow the pattern to put together something simple. Thinking and talking about the time, if that's challenging for you. For example, how long ago was it that we had lunch? My daughter said she'd call it 3. How many hours away is that? If you have emotional changes, surround yourself with supports. Not to do things for you necessarily, but to encourage you to do things for yourself. Monitor your mood. Get help if you need to. Depression is more common after stroke, but can be treated. So make sure you connect with your family physician. Consider online groups or Facebook groups or stroke recovery groups. And for all of this, very important to note that stroke recovery can and does occur for months and even years after the stroke. So as one of the speakers mentioned before, please try not to panic. There's lots of time for us to get things done. And lastly, for my final slide, I want to just talk about sleep and conserving our energy, because how rested we are affects everything else. Sleep hygiene, as we know, is very important. We need to listen to our bodies. Fatigue is very common after any neurological event. Consider using some relaxation techniques before bed. This may include some deep breathing, some visualization. Try to go to bed and get up at the same time each day if you can. Energy conservation is something we talk about a lot as therapists. Plan to do the things you need to do for the times when you have the most energy. Try to pace your activities. Take regular breaks or short naps before you get tired. This helps save your energy for things that you may want or need to do later on. Position your body comfortably and safely for the task. Consider sitting to do meal preparation tasks, or use a higher seat on your toilet if that makes it easier or safer to stand up and if it's been suggested for you. Prioritize and set goals that really need to be done that week instead of that day. Write things down. The days do tend to blend together. Reestablishing routines and habits during the transition to a new environment or back home is very important. We use up less energy once we've developed routines, and then can spread our energy on other things that we'd like to do instead. Don't forget time for leisure activities. Do something that brings you joy every day. This may take more of an effort now to figure out what that is, but it's so important for your well-being and your recovery. Things like listening to music, watching something funny on TV, making a puzzle, or cuddling with your pet. I wish everyone well with their recovery, one day at a time. Thank you very much.
Thank you, Brenda. These were very important tips and good reminders for people going through such large changes right now during a transition. Listening to your speech reminded me of my own recovery, and I found the slide with the resources very helpful. I would like to thank all of our speakers today for offering their time and expertise for this webinar. We hope that you as webinar attendees leave here feeling connected to others in your situation and that you have received credible information from experts in these fields. You can enter your questions in the question panel of the dashboard, and now we will have Patrice Lindsay answering.
Good afternoon, everyone. First of all, on behalf of myself and our teams, thank you to each of the speakers. You're all absolutely amazing. There's lots of comments being put into the online saying how great you are. So congratulations and thank you. For everybody listening, please enter your questions in the question boxes. We do have some already, and we're happy to entertain more. So the first question will be for Dr. Weinberg. Many people in Canada, especially in kind of the northern regions, don't actually have a family doctor. And at this time, when they've been sort of managing with drop-in clinics or their specialists, when it's hard to get a hold of their specialists, how do you feel about walk-in clinics, and are they providing the same level of protection for people without a family doctor?
Okay, thank you for the question. I think it is a very good question. I think that it's unfortunate that many people in northern communities do not have a family doctor. I know that walk-in clinics in the Toronto area are taking virtual appointments first and then only offering in-office visits if medically necessary. So walk-in clinics are using the same safe precautions and following COVID-19 guidelines during this time. I know that when it's hard to reach your own specialist, having a family doctor or a doctor from a walk-in clinic send a consult letter with your urgent concerns often will help the specialist get back to you. So using the walk-in clinic for a referral letter or a consult letter, even to your own specialist, often will help the specialist get in contact with their patients. Obviously, having a family doctor is the better option, especially for people with chronic illness and multiple medical problems, but walk-in clinics are a good, safe alternative if that's not possible.
Thank you very much for that. One of the big concerns for many of our audience, and even our speaker, Sherry, has had that experience, is the delayed and postponed surgeries. So question for actually both Sherry and for Dr. Weinberg. Let's start with Sherry. Sherry, have you been given any information regarding how you're going to be contacted and when you might be contacted for rebooking, or is it just, as you said earlier, limbo?
I'm in limbo until they start rescheduling surgeries again. I was told that once they start resuming surgeries that we would be called in order that we were canceled. So I was a week and a half away from my surgery. So hopefully once they resume, I'll be a week and a half away from surgery again.
Yeah, and one of the issues is going to be all the urgent cases that show up, yes, which is a normal flow. Yeah. And so, you know, that will be an issue. So Dr. Weinberg, can you also comment on this in terms of what
you know,
the conversation is?
I think it's unfortunate. You know, these are challenging times. Many surgeons are waiting for their operating times to open up to be able to put in their scheduled patients. I think nobody knows yet when elective surgeries will begin again, but we're all hoping in the next few weeks I think as the COVID-19 cases decrease, the hospitals will open up more for elective surgeries.
And can you comment on what the process might be? Do hospitals have to wait until is it the Ministry of Health that's going to make that decision to allow hospitals to open up, or is it going to be individual hospitals?
No, this will be a province-wide decision. Individual hospitals will have to follow the province's decisions on this.
Great, thank you. Brenda, question for you.
Yeah.
Everybody is really interested in apps, right? We all have this time on our hands and everyone's been on their computers and looking for apps and things to keep busy. Are there apps that you particularly approve of? Because I know within best practice, we look at a lot of them and generally don't approve most of them. And we had a previous webinar saying a lot of those brain training apps are actually not that useful because they're too repetitive. Can you comment on some apps that our audience might be good for our audience to think about, or types of apps?
Yeah, it's a very good question, Patty, and to whoever is posing this, because there are a lot of apps out there that might not be working on what you need to work on. You know, I have a list that I often go to for folks that I can certainly share and add into this webinar afterwards. I don't have it on the tip of my tongue, any names right now. There's certainly ones for cognition and for vision. And I mean, they are a really good resource, even for folks when we were seeing people, they would sit on their phones and maybe do some apps while they're waiting to be seen or waiting for their handy transit. It is a good opportunity to build in some of those repetitions. So I will certainly look into that and add that to my slide after the presentation. People can look back.
Great. What we can do, Brenda, actually, if you share that, we will, for everyone, we create a document with key messages from the webinar. So we take sort of those key messages from each of our speakers, and our team puts them into a really lovely document for everybody to refer to. So perhaps we can add it to the end of that. Dr. Weinberg, another question for you. We've heard a lot about people being concerned regarding having to go in for blood work, especially if you're taking blood thinners and need to monitor and adjust. And you did speak about going in for blood work. But one of the questions that we've had come up several times is this a time to be switching from warfarin to one of the newer oral anticoagulants where blood testing isn't required? What is your thoughts on that?
So I think that's a very good question. I prescribe a lot of the newer oral anticoagulants. I think it's very patient dependent. It depends on the patient's medical problem. It depends on a patient's renal function. So I think patients have to speak directly to their physician on whether they should change from Coumadin to a NOAC. That being said, I had to drop some tests off at a lab this week on my way home because we don't have lab pickups at the office anymore. And when I walked in, the lab was empty. The lab technicians were wearing full PPE. Patients are being offered an appointment. And I think if a patient was wearing a mask and gloves and the lab technician being in full PPE and the blood test is maybe a 2-minute contact with the technician, I think it's relatively safe if the blood test needs to be done.
Great, thank you very much. So one of the challenges is a lot of caregivers who are remote from their family member, right? So they're in a different location. Their parent is now alone and they can't be together because of the physical distancing and concerns. What advice do you have for caregivers to manage their own stress and to help with their loved one who happens to be in a different location right now, and kind of helping keep an eye on the medications and whether they're eating okay and all of those key things that caregivers do so well? Can we offer some thoughts on that? And I would like to hear from all three of you. Maybe we'll start with Cheryl. Since you guys are together, what advice do you have for other families who are trying to help each other?
There's a lot of like Zoom stuff like that where you can connect with your family that way, talk, go over your medications, what you need to be doing. We have the one time to get Jim out, actually it was Easter Day, we went to each one of our children's houses, dropped off an Easter bunny at their door, and Jim stayed in the car, and they came out but stayed away, and we talked. They were way far away and had a visit that way, so that you can like at least connect with them in person. And it was great to see the kids and the grandkids. We haven't done it since then, but that's also a way of like connecting with them also.
Great, thank you. Brenda, do you want to comment next?
Absolutely. Sorry, I think my internet is in and out a little bit, so hopefully people can hear me. Yeah, you know, there are lots of great resources, either you know, nationwide things for all Canadians, the Centre for Addiction and Mental Health. You can get emails from them on coping strategies and that type of thing, which is great. I know here in Manitoba, there's a lot of other things that have popped up, you know, seniors helping seniors, people willing to go grocery shopping for other people, putting their names forward to volunteer. So really just sort of link in with what's going on in your neighborhood as well as your city, just to see sort of what's going on. And as much as possible, I agree, connecting with your family and your friends face-to-face is really great. If you can do it over Zoom or Teams or something, actually see each other. Because I think over the phone is good too, but we sometimes miss some of that, the nonverbal communication piece. It's really nice to see people's faces. So.
And Brenda, another piece for you to jump on is, so in our previous webinar, we had several people say that they were having trouble getting their older parent to actually cooperate and do exercises and stuff when they weren't there to nag them every minute. And when they were in a separate location. Any advice for kind of encouraging people who are alone to actually keep up with their exercise regimes?
You know, that's a good question. I think it's important, you know, the real critical things is that people aren't developing, you know, the amount of stiffness that will lead to a contracture at this point. So, you know, if that is sort of an issue, then we'd be even more concerned. But, you know, trying to get people just to get up and about if they're able to move their arms, move their legs, do some gentle stretches. And if your loved one is really not wanting to, you know, that there's probably not too much that can be done over the phone to force them. But really reminding them, even if they just do a few minutes of something, that's really better than nothing at all. And I know there's online sort of exercise groups and yoga things that I have found as well. So sometimes maybe connecting them with some group where other people are also doing that from home, because it is hard for all of us to feel motivated sometimes on our own to do that.
Great, excellent, thank you. Dr. Weinberg, we're going to switch this up a little bit. So a question for you is exercising 150 minutes a week, which is what our guidelines say everyone should do, is it safe for seniors who have chronic heart conditions to continue at that pace? And what activities do you think are safest for them, especially from home when they can't be out on a supervised track or wherever?
I think that it should be activity as tolerated. So patients with chronic illness should do as much activity as they can tolerate. You know, everybody with chronic illness, heart disease has a different exertional level. So it really does depend on the patient. Again, using your community online resources, there are safe exercise classes online. I have my patients, you know, walk down the hallways with their walkers a couple of times a day with masks and gloves are safe. You know, it is safe for them to do. Those are some options.
Great. So maybe back to you, Brenda. Is there some kind of checklist for care providers, so care supporters, when the person with either a stroke or heart condition comes home, you know, to keep track of all the things that are supposed to be kept track of? Things that normally maybe a home care person would come in and keep track of. When that's not happening right now, Are there lists or things you suggest? Oh, I think you're on mute, Brenda.
There we go. Hear me now?
Yep.
Yeah, I think that that's absolutely, you know, here in Manitoba, we're lucky with our home care program still up and running with precautions, but the certain, you know, I don't know of an actual resource to provide with such a list, but things would be like important, like medication management and emergency access plans out of the house. Things like managing your skin and positioning, swallowing. Those are some of the big ones just to sort of watch. So as far as an actual list, that'd be a really good idea for someone to put that together. And I don't mind helping with that.
We'll work on that, and we will call you 10 minutes after this, and we will do that. So we'll attach it. So that would be a good thing to include as well on our on the notes that we make public for everybody after this. For sure, we'll do that. So thank you for raising it. Okay, we only have another minute left, so I think I'm going to end it there. Again, I want to thank everybody so much for, you know, for the speakers. I want to thank my team who are just have been working endlessly to bring information to people in our communities, people who are wonderful supporters of Heart and Stroke. We're here for you. We encourage you to fill out the evaluation because we want to know what other topics you want us to address. To all of our speakers, you're all on the front lines every day and giving of yourself. So thank you so much for that. And for everybody, please take care of yourselves and your loved ones. Reach out in any way you can and stay safe.